What would you say if I told you you can virtually eliminate the possibility of you ever having another cavity in a tooth for the rest of your life? Even more importantly, what if I told you that you could help prevent your children or grandchildren from ever having another cavity or ever having their first cavity, for that matter? What if I told you that your children and grandchildren, if they're below the age of 10 or 12, will probably never have to have the painful surgical procedure of having their wisdom teeth cut out by an oral surgeon? What if I told you you could reduce the risk of your children ever needing braces by 95%? That sounds pretty valuable, right? Well, I'm going to be having a discussion today with Dr. Steven Lin, who's a dentist who wrote a book called The Dental Diet, and we're going to break all this stuff down. So if you know someone who's had lots of trouble with their teeth, and this includes gingivitis and oral gum disease, please share this video with them wherever you think it'll help the most people. If you know a parent or a grandparent and they want to help their children and grandchildren never have another cavity, this is the video to share, okay? I see that Dr. Lynn is now joining us. If you have a question for Dr. Lynn, ask it in the comments, and we're going to have a ton of comments, I would imagine. So every minute or two, if we haven't gotten to your question, just type it in again in the comments. And always, you're welcome to share this with anyone you think needs to hear it. Okay, now let me have Dr. Lynn. He's joining us from Australia, I think. Let me join him into the stream. There he is. Hey, Doc, can you hear me?
Hey, Doc. Yeah, I can hear you well. Can you hear me okay?
I can hear you great. It's such a pleasure to finally hook up with you on a live like this. I think we're going to talk about some very important stuff today. I've got your links to your website and to your book in the show notes. So if anyone wants to check out Dr. Steven Lin, my friend who's a dentist from Australia, is that correct?
Yeah, just north of Sydney, Australia. So it's 8 a.m.
So you're a northerner. Okay. But you can click those links and check those out. Now, Dr. Lin, before we get started, I want you to tell our viewers a little bit about yourself and your book and why we should care what you think.
Yeah, so my name's Dr. Steven Lin, and I'm a trained practicing dentist. I'm in my clinic at the moment. And my path in my career has been following the story of how food and nutrition affects the oral cavity and the dental diseases that we see very commonly in society today. And so I've got a biomedical science background. So I finished dentistry and I was out there practicing in the world, and I was kind of finding a lot of situations with my patients and conditions that they were suffering that weren't making a lot of sense in terms of what I could explain to them in terms of my conventional training. And so my book, The Dental Diet, is all about basically the lies that our dentists have told us. To put it kind of in a way that's probably a little bit maybe looking at the dental industry in a negative light, but I actually take a view that we're all learning and that that this is all coming together in a scientific fashion. That progress is taking us forward to understand how food affects the mouth, the jaws, how crooked teeth, how tooth decay is prevented. All of these things are intervenable, and it actually connects really nicely into great docs like yourself, Ken, that are showing that the food and the conditions that we're seeing so commonly in society today are all connected to physiological processes we can scientifically explain.
Absolutely. I totally agree. And I think that you're a lot like me in some ways. I'm not anti-medicine or anti-medical practice. I'm a licensed practicing doctor, and I don't hate my colleagues, but I do hate a lot of the misleading, harmful advice that they give, and advice that costs patients lots of money, that doesn't really lead to any medical improvement whatsoever. Or, it may cost them $100 a month and it gives them 1/100th of 1% of an improvement in their health. I'm not for stuff like that. And so I'm not trying, and I don't think you are trying to denigrate dental practice or medical practice. What I'm trying to do is reach enough of the people, so enough of the people go to their doctor and say, hey, this crazy guy on YouTube said this. Why are you doing this? I want enough people to do that so it finally pisses their doctor off and makes them say, what the heck? Maybe I need to look into this again. That's my ultimate goal. is to educate doctors through their patients, because I don't think I'm ever going to be able to do it through the American Medical Association. You know what I'm saying?
Yeah, it's difficult. There's a huge learning gap, and there's so much research that has come out in the last 10 to 20 years. You know, a lot of professionals don't have the time, or haven't had the opportunity to be able to educate themselves in that. And then the application into practice is very difficult. You know, dental practice, for example, is very regimented, and the practices are designed like that because things go wrong. It's difficult to practice in the mouth. It's hard to put restorations in. You know, dental disease is a difficult problem to fix, and that's why dentists are very set in their ways, or the training is very set in its ways. So you're right. There's kind of there's a set in the convention how we've trained our entire medical professional, and then how we've got to kind of move forward to this more lifestyle. And what patients are doing at home is really what matters the most.
100%. I totally agree. And that matters the most in medicine as well as in dental care. And I know that probably more so the practice of dentistry, you only get paid if you fix things. You don't, I mean, you might get paid for an annual checkup or something, but the bulk of your money comes from repairing cavities or doing all the dental procedures you guys do. And if people follow your dental diet, you're going to cut into dentist income a little bit. And the same goes for my book, Lies My Doctor Told Me. If people practice what they read in that, they're not going to need their doctor as much. And I think a lot of dentists and doctors are threatened by that, not understanding that what their real goal is not to make the Mercedes payment and the beach house payment. Their goal is to help their patients be as healthy as possible. And I love that you're a dentist, but your practice extends far outside the mouth. And I hope the Australian Dental Society doesn't get mad at you for that. But the advice you give doesn't just help people's teeth and their oral health. It helps their entire body get healthier. And I think that's also a good doctor is going to help his patients have healthier teeth. And I think it goes both ways. And we absolutely need to work together as partners to maximize our patients' health.
Well, that's the thing is that, dentists and doctors have, for the most part, and still for the most part, work very separately. These kind of conversations aren't very common. And, for what you're seeing in your office, your patients are being told that it's a completely separate issue as to what they're seeing in my office, where, I'm seeing gum disease. And a great example is type 2 diabetes. I'm seeing a patient with, moderate to severe gum disease in their, mid to late 30s. And the issue is that their blood sugars are out of control, and they're pre-diabetic. They haven't been diagnosed by their doc yet. And, until they get that diagnosis and we start understanding, that their diet is controlling their, or pushing them down the road to insulin resistance, then, I'm never going to be able to control the gum disease. And so what the beautiful thing about the mouth is that I find that you really pick up the first signals, before they become a really chronic disease, and they tell you very, very directly what's happening in the body, and it's all connected to food. But one of the things that really kind of opened my eyes was a doctor speaking about this stuff, and it was Kate Shanahan, actually, who wrote the book Deep in Nutrition. Yep. And so that one was kind of like, because she connected her work to Weston A. Price's work, who was a dentist in the 30s that talked about all this stuff, nearly 100 years ago. And then that really turned the light on for me, because I'm an evidence based guy. I don't take things lightly, and won't say things to my patients unless there is a good evidence base behind it. Yet there was this doctor talking about how blood cholesterols and how fat intake and how insulin resistance was all related to the type 2 diabetes epidemic we're seeing, and that a lot of the foods were just fueling it. And then it made a lot of sense to me as a person. But then the science and physiology just made absolute complete sense. And then it connected exactly to what I was seeing in the mouth, and then the whole picture starts to come together if we just kind of take a little step back.
Yeah, I totally agree. And you may not know this about me, doctor, but when I started this health improvement journey for myself, I was morbidly obese, pre-diabetic, had severe gastric reflux, and I had a substantial amount of gingivitis or gum disease. And as I've kind of progressed from eating the standard American diet and the American Diabetes Association diet, which I think is just as bad as the standard American diet, and moved kind of to more ancestral, primal, paleo, and now ketogenic. And then for the last 14 months, I've been almost exclusively a fatty meat carnivore. My gum disease is completely gone. And I've seen a couple of questions about gum recession. So while I'm here, I still do have the tiniest bit of recession from that gum disease. Is that reversible at all with diet? I've had several people asking this question, just mild to moderate gum recession. After you've taken care of the underlying gingivitis or gum disease, will that recession get better?
Yeah, so it's an excellent question, actually, because a lot of people have this issue. And if they go on a healing journey, they'll actually find that the tissues settle down and then you don't have active disease. But the ongoing question is, will the tissue grow back? And so gingivitis is an inflammation of the gum tissue. Gum disease is where it progresses to periodontitis, and that's a chronic infection of the bone. And so if the gingivitis is infected for long enough, that's just bleeding gums. So anyone, if you floss your teeth, or even if you brush and you see some blood, that's inflammation of the gum tissue and gingivitis. That can progress to periodontitis. And all periodontitis is it's an autoimmune reaction of the body to break down the tissues, the collagen ligament that connects the gums to the bone. And so what happens if you have it long enough, the bone starts to run away. And this is what dentists will measure in their offices, and they'll tell patients, and they'll clean around that interface between around the ligament and the root of the tooth to make sure that calcified plaque isn't getting built up there. But so what happens if you lose attachment and you lose bone around the tooth? It is difficult to regrow, but you can stop the process. So for most people, if you stop the process and you prevent it from going further, yes, the tissue will resolve at its point of loss. You're not going to grow back. You can gain some attachment back. So the measurements that the dentists take, they'll measure the actual pocket. You can gain some attachment, which is how the gum reconnects the ligament to the tooth, but you won't regrow the bone. So some of those measurements will be with you for life. But that's fine. That's okay, because that's where you're at. You know, that's your journey, and your teeth are going to be okay because you're continuing to, to give them the raw materials they need to maintain both teeth. The main thing is that inflammation profile is gone and it's not progressing.
Yeah. And now I preface this discussion with kind of a preview, saying that you can basically reverse your risk of ever having another cavity for the rest of your life by 95%. And I just pulled that number out of my butt, but I think that's fairly accurate. And I also said, if you'd like for your children to never have to have the painful procedure of having their wisdom teeth or the third molar surgically cut out, this is the diet. And if you'd like to greatly slash the risk of your child ever needing braces, this is the diet. I call it the proper human diet. You call it the dental diet. And I think both are very accurate. Let's dive into the diet now. Tell people what's your list to avoid? What's your list to add? What are the vital foods, the vital vitamins? Take this where you want to go.
Yep, so exactly. So I think one of the most important precursors on how humans should eat is how the jaws grow. Because when we have crooked teeth and crooked jaws, these sit in the maxillar and mandibular bone, and the maxillar bone holds your airways. And then these muscles connect into your craniofacial system that are the base of your brain. So there's nothing more human than that. And so when our teeth are crooked, which is a modern agriculturally driven, so when we move into industrial society, then we get crooked teeth. And this becomes between 7 to 12, early adolescence, when kids have braces. That's a jaw growth issue. It's a sign they're not getting enough of the nutrients. And this is why we've got to recalibrate our idea of eating to stop thinking about calories and silly things like that, and macronutrients. And we need to think about what are the nutrients our body needs. And so you mentioned wisdom teeth impaction. So wisdom teeth impaction is just a jaw growth issue at late adolescence, when the third molars are trying to grow in and the jaw hasn't grown back and out enough. So it's all a craniofacial growth issue. And this is how foods drive the calcium metabolism, putting calcium into bones and teeth. Your body will do that naturally. So when we eat the human diet, then our body does that on its own. Now, the foods to avoid. So this is all based on the work of a dentist that went around the world in the 30s and showed that when people eat the modern diet, their jaws and teeth deteriorate. And the numbers are around what you said. Tooth decay doesn't exist largely in human populations. Anthropologists laugh when you ask about dental disease in population doesn't exist because people eat the proper human diet. It doesn't happen. But what he found is that there were three constitutions. And you got to remember, he was writing this in the 30s, and he said it was sugar, vegetable oils, and refined flour. And so, for the most part, this is a big part of your message, which I love, is that that's refined carbohydrates, which nearly makes up a huge percentage of the modern diet now. And a sneaky one that in the US is a huge issue too, but a problem across the world is the refined vegetable oils. And so these ones sneak in, they're healthily packaged, but what they do is they stop your body from absorbing the nutrients that your bones and teeth need, because we have a packaging system that goes around the body that delivers, and they're fat-soluble vitamins. That's the critical piece, to your diet that puts calcium into bones and teeth, creates immunity to tooth decay, helps kids grow their jaw, because these are fat-soluble vitamins, and so the most common ones we know is vitamin A and vitamin D. Vitamin D is a hormone, and vitamin D stimulates insulin-like growth factor, growth hormone in the body. And so when kids are growing, the body needs all these nutrients for the jaw to grow and widen, and then all of the calcium to go into the bones and teeth. And so the last factor that Price found was vitamin K2. So these three things work very neatly together in the body. They're found in animal foods.
He didn't know what it was, right? He called it factor X because he didn't know exactly what it was. Is that right?
Yeah, it's a really interesting story, because when I was originally reading Nutrition and Physical Degeneration, I didn't get it, because he was kind of mentioning A and D, and he was saying, oh, and there's Activator X that's always in the food. So he actually measured the food in all of these continents around the world and compared it to the American diet back in the 30s. So you can imagine how much we've stripped out since then. And he was showing that the traditional human diet was 10 to 20 times richer in fat-soluble vitamins, A, D, and Activator X. But he died before he ever realized what Activator X was. And it actually took 70 years for a guy named Chris Masterjohn, who does a lot of online nutrition education at the moment, really switched on guy, PhD, I think in Brooklyn, New York. And he actually connected literature in Japanese and Eastern European chemical literature, because it's a very specific compound, the vitamin Ks. And so we were taught, vitamin K is a vitamin K1 nutrient that promotes blood clotting in the body. But there's many other K2 vitamin K nutrients, and these are the vitamin K2s. That was the Activator X, and Masterjohn found that K2 was actually the Activator X, and it's this huge story that we've missed. You won't find it on any food packaging. One of the most important nutrients that you'll never hear about, found in organ meats, in egg yolks, and grass-raised dairy, in fermented foods. There's two types of it, but we just don't get it in the modern diet, and it's critical for healthy teeth, healthy jaws, and developing kids. So preventing braces, preventing wisdom teeth extractions, we can do it all if we have these nutrients in the body. The body does it itself. It's amazing.
Yeah, I think you and I are both have great respect for the work of Weston A. Price. And Nisha, if you're watching, will you put a link to Dr. Price's book in the show notes on Facebook and YouTube, because people need to know about that book. Hugely important. And so Price went and he looked at indigenous populations that were really untouched by the modern Western diet. And these people had beautiful teeth. They had well-developed maxilla and mandibles. They were nose breathers, not mouth breathers. All that stuff was very, very rare that we, as doctors and dentists in the U.S., we see that every single day. It's very, very common. I actually came a little different path to Weston A. Price. I've been studying paleoanthropology for a couple of years now. And when you start studying human skulls, further back than 15,000 years, right? There's literally no cavities in the teeth, and there's never a dental abscess, because that shows up in the fossilized remains of the maxilla or the mandible. If they have a severe dental abscess, back then it would kill you. And so, but about the time that we started farming and had access to lots of grains and lots of starchy foods, that's when you start seeing severe dental abscesses and just teeth worn down and cavitated until they're just no longer usable. as food choppers. And so that's kind of how I came to it. So I think Weston Price was looking at extant populations, and I've been looking at extinct populations, but we're seeing the same thing. Before you add sugars and before you add grains and before you add starchy tubers and in my opinion, a lot of the modern fruit that's been crossbred to be basically just a big sack of sugar, before you start eating that stuff, dental abscesses are unheard of, and cavities in the teeth are very, very, very rare. And there are so many people out there that don't have a clue that that's true. And I think there are many doctors and dentists who they don't think about that. Like, no, it's this cavity that you're about to fill and get paid $150 for. It was caused by the diet that this child ate.
Yeah, it's a really mixed up story because, it's crazy that, in my dental education, I didn't get a lot of anthropological perspective. And, nearly all of anthropological record is written in jaws and teeth. So it's amazing that you've dived into that kind of perspective because it teaches us about our deepest health stories and what our bodies were doing and what people were eating thousands of years ago. And teeth tell us exactly what the bodies need. Price was actually showing that there was this surviving lineage of people who were staying on their traditional diets. Now, in the 20s and 30s, the modern diet hadn't even ramped up. So it was kind of before it really hit where, the modern stage that we see today. But what he was showing is that as soon he was finding it more as an aberration, is that when you intercept the modern diet and you look at the people who stay on their traditional diets, he checked the anthropological record. He would go through and find places with jaw remains and find whether they had dental disease because you can do it. And he found that as soon as people ate that modern diet, right bang in one generation, the teeth and jaws deteriorated to the point where he took 15,000 photographs. And so anyone, if you're on the computer, you can Google Weston A. Price and you can see the photographs. They're black and white. It's an amazing study. It's very unconventional. I didn't really understand it at first because there's so much to it. He's actually talking about craniofacial growth. And this goes very much into a huge body of literature that we're now seeing in sleep apnea because people aren't breathing correctly. But it's all connected to exactly when we eat the modern diet. Now, we have to remember as well that in the 50s, that's when the sugar industry really started to ramp up. And so all these foods that Price was talking about wasn't even all that available. And now it's everywhere. And so what we're seeing in the offices today is the 70-year, basically, a testing ground for the, Price's hypothesis. He said, if you eat this stuff, your jaws are going to deteriorate. Your body, you're going to be sick. You're going to have. He didn't know what type 2 diabetes was. Doctors trained in the. I'm not sure when you trained, doc, but I spoke to an MD. He said, I trained in the 70s. I opened my office. We did one class on type 2 diabetes, and he said, open the doors, and there was this flood of people. And so this didn't exist until we really ramped up. The cereal culture, the sugar hidden in food, and devoid of the fat soluble vitamins that our bodies need. So there was a two-pronged factor that Price was trying to warn us of, and we just completely missed the story.
Oh, I totally agree. And so many people out there, if you're not a doctor or a dentist, then there's no reason for you to know this. But people think of their bones like rocks. Like they are what they are. You can't improve them. They just exist, right? But the truth of the matter is that all of your bones in your body at any age are very fluid, and you can strengthen them or you can weaken them, both with the diet that you eat and the diet that you should be eating, and with exercise. And we have a 7-month-old now who is exclusively breastfed from day one. And he, about 5 months of age, he started getting his first 2 teeth. And I started, after I would finish the meat off a rib bone, I would give him my rib bone and he would chew on that and gnaw on that. And then we tried some scrambled egg. And then he was eating some beef brisket. He's eating pulled pork barbecue, a little bit of avocado. He tried a pickle, he tried an olive, but he loves meat. And so how can a young parent or a grandparent who's really involved in their grandchild's life, how can they change that child's diet? in order for them to never have to have their wisdom teeth cut out. Because in reality, there's nothing wrong with the wisdom teeth. It's just that the jawbone hasn't developed enough to be able to carry all of the teeth that it's supposed to carry. And a lot of people have come to think it's normal to have your wisdom teeth cut out. That's not normal. That is an abnormal surgical procedure that should be unnecessary. So how can a parent or a grandparent start today, start tomorrow, helping their child to keep those wisdom teeth, which are obviously needed or your body wouldn't put them there? What can they do?
Yep, so it's exactly as you said, Ken, is that the jaws and teeth are a living, breathing entity. You know, they're not a porcelain vase that shatter when, you know, by accident. They break because we don't give them the right nutrients. And for teeth, you know, for parents, when you look, you know, one of the most distressing things for a parent is to see a hole in their kid's teeth, you know, a big black, but it is very distressing. And you know, it's really one of those things I think we really need to help, you know, the wider community start to understand, is that if we get these kids the right foods, and also goes back to prenatal nutrition as well, bones and teeth listen to our kind of oldest genetic messages. So we need to feed ourselves the right thing. You know, mothers who are nursing their child need to make sure these foods are going into them, because it's, you know, vitamin D deficiency, for example, we know in the literature translates through the breast milk. So breast milk is not all the same, and that we need to be nourishing ourselves as well as our children. But then for kids, you know, the great message is that teeth have an immune system. So if you feed them these fat soluble vitamins, and so for my son, I've got a 22-month-year-old and a 5-month-year-old, and in my son, I put cod liver in his milk, you know, and he has, you know, he hasn't had a piece of fruit in his life. You know, all parents don't necessarily have to do this, but similar to your principles, you know, you start them young, and that's what they go for. You know, he eats eggs every morning. You know, he's never had a refined carbohydrate. But so the main principle is that they have to have the fat soluble vitamins. So they need to get these. You have to work in the fatty meats, you have to work in the organ meats, you have to work in the egg yolks, and the whole fat dairy if they tolerate it. And that's what provides, their bodies are, you know, the literal sponge for these things, and it'll create the physiological barrier to tooth decay. So if your child has a hole in their tooth, you can change that. There are cells inside the tooth called the odontoblasts, which are very, very similar to osteoblasts that create bone, and they're an immune cell. And so if they're run by these nutrients, vitamin A, vitamin D, and vitamin K2, so you feed them the protective factors and you remove the harmful factors, and the bodies will start to do it itself. So for tooth decay, that's the first sign of how we're managing calcium balance in a young child. Now, as they grow and develop, you'll start to see whether the teeth have space to come in. And so kids, oh, we're back. Sorry.
There you are.
Got you there?
Yep.
Okay. All right, we're good. So kids that are growing, so between 6 and 12, for example, but this happens right even when we have just baby teeth, their jaws are developing, and you have 32 human teeth raring to come in. So at 6 and 7, they start to grow. And so what you need to watch is that functionally, they're helping this craniofacial development. This is an area called myofunctional orthodontics. So we can intervene, we can help the jaws grow. That's what we do in our clinic. We prevent braces. We get to the problem before, and it's all to do with breathing, because when we nasal breathe, and which expands the maxilla, which creates the platform for the upper teeth, which creates a platform for the whole entire craniofacial system, then we create an expansive growth pattern that will then start to create a posture where the child is not mouth breathing. Because if the child mouth breathes, it stunts the growth of the jaw, the maxilla, the roof of the mouth. And what happens is that then you get crooked teeth. So these are the facts. So if you watch your child, if they're open mouth posture, we need to teach them to breathe through the nose. And for some kids, this will be difficult. You really need to watch their sleep, because if they breathe through the mouth through 8 hours of night, this is when all the growth and development is happening. It's where the brain needs all that nitric oxide rich air that goes through the nasal sinuses. then they're starving themselves with that. So we need to move our kids and be careful about if there are sleep breathing issues, because it helps the growth of the jaws. If this is all corrected, the nutrients, the breathing, the last factor is the tongue posture. So the craniofacial posture, so tongue to the roof of the mouth, and it's kind of this kind of movement. It's a suction to the roof of the mouth, and that's right back to the soft palate. And when you swallow, that creates an upward-outward movement that supports the neck and cervical spine, supports the airway, the oropharyngeal, the throat holds open. You breathe correctly, you create posture. This is why singers have such great craniofacial structure and actors, because they use their voices so well, because their breathing and their airway system is all working well. So when all of those things come together, a child grows and develops. The nutrients that they eat and the air they breathe and the sleep that they get, all of those things come together, and they'll never have a tooth issue. They'll never have wisdom teeth impactions. They won't need braces. And this is one, it's a big problem to fix, because a lot of people are kind of halfway in this. They've kind of come along to this information. They say, oh, I had this issue. So if you're a parent with these issues, you have passed a predisposition onto your child. That's fine. We just need to understand it, and then we can intervene in these factors. Some kids, they have a tongue tie when they're born, and it prevents them lifting the tongue to the roof of the mouth. So that's an important thing that the early pediatricians need to get on top of, and the parents need to understand if kids have trouble breastfeeding, it might be a lingual freedom. All of these things come together in craniofacial growth, but it's largely driven by food, stripping out those nutrient poor foods and putting in those nutrient dense animal fat soluble vitamin rich foods.
I totally agree. Beckett's next foods that we're going to add in, I was talking to Nisha, my wife, last night. His next foods we're going to try is cod liver, and he's going to try some fish roe, black lumpfish fish roe, and then maybe a sardine. And that's going to be his next additions. And some things, he likes everything he's tried so far, except he doesn't really like avocado, and he's kind of wishy-washy on scrambled eggs. But every meat that we've given him so far, he just gnaws it like crazy. So let me sum up what I think I've heard you say so far. So it's basically three things. Number one, you got to remove the things that are not nourishing the teeth and that are actually causing active tooth damage, like sugars, like grains, like industrial seed oils, any high sugar food. Number two, you've got to add foods that give you everything that the odontoblasts need to not only build teeth, but maybe even to repair teeth, right? And then children, especially when their mandible and their maxilla are developing, when they're still growing, they really need to have foods that they need to gnaw on and chew on, like we've done for the last 250,000 years. That stress on the jaw bones actually helps the jaw bones develop. Have I got you so far?
Absolutely. So we didn't mention the chewing, which we talked about with your son. But so that physical factor, which is the things I spoke about, is the breathing and the tongue posture, but the chewing, it's a musculoskeletal joint. So people go to the gym, you go and work out, to build a strong musculoskeletal joint. It's the same with the jaws. So kids need to chew on raw foods, bones. They need to rip and tear. This is what we're designed to do. And so when you use this correctly, this is how you get the cheekbones that are defined, and you get the jawbone defined. That we are a long way. When you look at the anthropological records, we just don't have these jawbones anymore. And to put it into perspective, when I had a patient come in, and he grew up on a farm, so grew up on a largely kind of more traditional diet, big jaw, huge round head. He'd since moved to the city, and he had a hole in his wisdom tooth with a big filling. He wanted the tooth out, and I'm kind of like, great, got to take this wisdom tooth out of this guy with a jaw like a rock. And anyway, it was the worst afternoon we both ever had. I was sweating, it was terrible. But so basically, to get this wisdom tooth out, I had to drill bone away from around the wisdom tooth, right? So it was thick bone. And eventually we got it out, and the poor guy, he left, kind of with a gauze in his mouth. But then when you look at kids today, when wisdom, some teeth are impacted now and they need to come out because they get infected, right? So, but when you take the when you lift the gum up and you look at the bone, it's paper thin. It's literally you touch it with a surgical handpiece and it basically dissolves. The bone that people are putting down in their jaws today isn't the same because the body does not have the raw nutrients to place that calcium in. The calcium metabolism depends on vitamin D, vitamin A, and vitamin K2, and we're not getting enough of these foods. And a lot of it is foods that aren't very popular. Like cod liver oil, which our grandparents all tried to give to our parents, which we've lost, and which really was, this is where vitamin D was discovered. When in the rickets epidemic, when kids, their femurs and their leg bones were not developing. It's because they weren't getting enough of this nutrient. We know then in later life it becomes osteoporosis. So why haven't we connected this to an actionable, disease process we can prevent in the mouth by eating the right foods?
Yeah, 100%. Totally agree. I've had a couple of questions. Somebody wants to know about flossing their teeth, and is there any research to back that up? Or would you recommend a water pick type instrument instead? And then also brushing your teeth. Should we brush our teeth 3 times a day? Is that necessary? Is there research to back that up? Is flossing and brushing necessary to prevent cavities, or is it not?
Well, so if you look at the history of how long oral hygiene has been in the human behavioral trait, it's decades. So do we need it? No. But do I say that we shouldn't do it? No. I floss and brush. But so we have to put it into perspective. So the evidence in 2014, the FDA actually came out and said that there wasn't enough evidence to recommend flossing, right? And so everyone's kind of like, what? My dentist has been telling me to floss every day. And they're telling me that's why my teeth aren't very good. Well, the reason why that is because flossing only intervenes in one small factor of what's happening in the mouth. So it's the interproximal plaque, which 30% of the plaque that builds up in your teeth is between your teeth. So when you floss, you take that 30% and clean it out. But the issue is that not everyone's plaque, we now call it biofilm, is carcinogenic or is pathogenic. And bacteria are actually involved in the process of mineralizing teeth, for instance. And they use the minerals out of saliva to build their own biofilm, and then they help teeth remineralize if we give them all the right factors. And it's the same, it goes back to how our diets have changed our oral microbiome. So you hear a lot about the gut microbiome now. You don't hear so much about the oral microbiome. It all starts here. We swallow thousands of bacteria every second. And what's happening is that they're in constant communication with what is the immune system, which is in the gut. And so the oral plaque is a part of this system. When you get things like intestinal permeability and the conditions that disrupt the immune system, that's all goes back to the first signs, to what we were first talking about, Ken, with bleeding gums and periodontal disease. So the first signs of gut dysbiosis, leaky gut, which they kind of calling it now, it actually begins in the mouth, and plaque and bacteria is part of the story. So when you look at those studies, oral hygiene, yeah, it can help in certain situations, and yeah, do I do it? Yes. But it's only part of the fact. If you eat properly, no, you don't need to, because you'll have a functioning human physiology. Like,
looks like we're hung up a little bit. We'll give the doctor a second. There he is. Okay. I lost you for a second, doctor.
Yeah. That's
okay. I think we're back now. Good deal. Yeah. And so, you're saying that if we eat the proper human diet or the dental diet, we'll actually encourage a mouth microbiome that can actually strengthen and repair teeth. Whereas if we're eating the standard American diet or the ADA diet or any of the other high carbohydrate diets, we're actually encouraging the growth of bacteria that are very good at breaking teeth apart. Is that what I heard you say?
Yeah, so when you look at the records, so when anthropologists pull off dental plaque from old samples, roughly around the agricultural revolution, we find we lose diversity. So what we do when we eat the modern diet, we lose diversity in the bacteria. And so bacteria that cause decay and gum disease and other conditions, downstream in the gut, they live in the biome normally. So it's actually creating diversity through food that actually creates the immunity to tooth decay, for instance. There are bacteria in the mouth that create immunity to decay. The bacteria Streptococcus mutans lives in the mouth normally. It's got all the other guys keeping it in check. When you eat simple carbohydrates, strep mutant starts to flare up, and the other guys start to they start to lose their footholding in the mouth, and then you start to get an imbalance. Once you eat enough of this stuff, which we've now been doing for a few generations, it fuels this relationship, and then we get a kerygenic lesion. And then the same thing is for gum disease. And so it's an imbalance, and we've lost the diversity in our oral and gut microbiome, which is connected to nature, connected to the foods we eat, and protective. Bacteria are completely implicit in our health, and that's an amazing thing that medical professionals aren't really taught that yet. So, but eventually we will. I hope we will.
Yeah, and I love the way you say that. I've got a couple of super chat questions. Let's knock those out. Carl says, do all carbs cause tooth decay, or can I have them once or twice a week without issue as a refeed? What do you say to that?
Look, I'm not completely against it. If you have the protective factors, I think you can eat carbs. We did have access to sweet things here and there, but it's all balanced. If you eat the protective factors, your body will not get decay. So I don't think you have to absolutely cut it out. I think if you've got a condition, if you've got active decay, you might need to think about that, or you've got a metabolic issue. But overall, eating carbs a couple of times a week, that's fine.
Yep, totally agree. And then Rob Van Pelt says, my 7-year-old son has deciduous molar hypomineralization. What can be the cause?
So molar hypomineralization it's a condition that affected the child when that tooth was developing. So this was in utero, and so it could have been a fever, it could have been a deficiency, usually a fever or a sickness. And then either when the child's very young, if it's their adult teeth, or when they're in utero. And so all it means is that when that enamel was forming, is that the body was disrupted and it couldn't quite put the pieces together to look. And so it might increase their risk of decay, particularly for that set of teeth. For a deciduous tooth, don't worry about it so much. You get a second go at it, so great. So give them the right foods, the body will take care of it. Don't worry about it too much, and the tooth will fall out, and you should hopefully have a nice crisp adult one coming through behind it.
I love it. I love it. I've had several people ask that, and a couple of people said they went to the dentist, had a small cavity, and we're going to go back and get it filled. And then for whatever reason, life happens, they converted to a very low carbohydrate diet, high in fatty meat, and they went back 6 months or a year later, and the cavity was gone. At our adult cavities, and I'm sure I'm not talking about a severe cavity here. I'm talking about I don't know how you guys, is it stage 1, stage 2, or have you seen cavities in teeth that have been diagnosed, that are existing, get better when you start eating the dental diet or the proper human diet?
Yeah, and this is taught in dental school too, that teeth have the ability to remineralize. So at a certain, you're right, at to about stage 3. So you've got the enamel, which is the outside layer of the tooth, and you've got the dentin, which is inside. When the decay is even into, if it breaks the enamel, you're never going to grow the enamel back. I've never seen enamel reform because you don't have the cells that form when the teeth is under the gums. But the dentin is it can completely remodel itself. So it can form over. It's not going to look very nice, but for enamel lesions, you can remineralize them. So sometimes there'll be like a sticky pit that a dentist will pick up and say, look, this might need a filling. If you take out all the factors and you re-nourish your body, connect to sunlight, to all these foods we've talked about, then the body's going to have the ability, those odontoblasts are going to send up, there's little tubules in the teeth, and they transport fluid, and it can remineralize these things. And this is known, this is taught to dentists too, and this is why dentists will be preservative in some stages of tooth decay, but they're not so versed up on the diet side of it. So everyone that has a cavity diagnosed, they should be thinking along these lines, regardless if you have the filling or not. If you need the filling, you need the filling. Sometimes you need them,
Right.
but the architecture underneath is what your body is going to be using. So you should be really going to your diet and reading your book and getting on top of the foods to make sure that it doesn't happen again.
Yeah. And so everybody listening out there, we've got about 800 people with us, Dr. Lynn. If you go to the dentist and you've got a stage 1 cavity, I personally have never had a dentist tell me, "Oh, Ken, it's fine. You can just go home and change your diet and this will correct itself." No dentist has ever told me that. They've always said you need to have that filled. And I think that's most people's experience as well. And so again, dentists and doctors, we get paid for the procedures we do, and it's human nature. You want to make your car payment and you want to put your kids through college. But at the same time, I feel like dentists, just like doctors, are duty bound to tell people the truth about this. And I don't think a lot of people, if you've been told by your dentist that you can reverse a cavity or cure a cavity, put it in the comments, because I've never had anybody tell me that their dentist told them that. But I hope that more and more dentists will jump on board and start to relay that information that you say they're taught in dental school. What about fluoride? Let's touch the third rail here. Let's talk about fluoride. Should we use a fluoride toothpaste? Is that necessary? Should we have fluoride applications at the dentist? Is that necessary? Should we drink fluoridated water? Is that necessary for strong, healthy teeth?
So everything we've talked about, Ken, is the full picture of human physiology and everything we know about what we know that humans, have the innate ability to be completely immune from tooth decay, and this is not included with fluoride. So fluoride isn't a necessary nutrient in the body. Fluoride is a useful adjunct because it integrates into the tooth enamel. So if you ingest fluoridated water and you put fluoride topically onto a tooth, it will actually change the hydroxyapatite, the calcium structure of teeth, and it will integrate in. And the rationale behind this is that it creates a more acid-resistant tooth structure. And so whilst that is true, and so in certain cases, treatment with the fluoride might be warranted, but for the most part, the preventive aspect, fluoride is an antibacterial. So when we're moving into the microbiome era of medicine, which I hope we are, we should never be putting a broad spectrum antibacterial into our digestive system every day, because we know that increases our risk of disease. When we look at we step back and think, anthropologically, from a biome perspective, if you disinfect, if you take away the diversity of the population, then you begin to push ourselves along to disease. And so whilst fluoride might have that mitigating factor, for the long-term factor, we shouldn't be having antibacterials every day. So there might be a treatment that you need with a professional, with a dental professional, but I don't recommend using it every day because it's not needed. If you eat the right foods, if you balance your biome, and if you have a lesion, you can reverse these processes in the body by eating the right foods. And so when we're talking about treatment, yes, fluoride might be necessary here or there, but talk to your professional about that a lot. In day-to-day use, no, I don't use it myself. I've never had a cavity. I weaned myself off the fluoride toothpaste because I was so connected to it. But overall, if you look at the physiology, you don't need it.
Yeah, we use toothpaste that Redmond's makes, and it's non-fluoridated. I think if you're eating the proper human diet or the dental diet, you don't really need to add fluoride willy-nilly at home. Now, and I definitely don't think that drinking fluoridated water is going to help you. I've actually had dentists tell me that drinking fluoridated water, that if a pregnant woman is drinking fluoridated water, it helps her unborn child's teeth develop in the gum. And after I looked into that, I'm like, where did you get that from? Because I think that fluoride only helps if it's a topical treatment, and I would say more of a directed topical treatment. Some people might need it. Most people don't need it. Does that make sense?
Well, yeah, fluoride is a really funny one when you look into the literature. Yeah, they do show it's effective at a low dose over. So they say that this is fluoridation. So what they're saying there is that when the tooth is mineralizing, you're going to get this hydroxyfluoroapatite instead of the hydroxyapatites. So there's a rationale for that, but my concern there is that if it's interfering in the calcium system, which I'm going to be looking into a little bit more, what are the other potential side effects of that? Yeah, so we've got to be thinking in that realm. And this is intervening in human physiology, so we have to understand every aspect of it. Right. There's an argument for it. There is an argument to what they were saying. Yeah, absolutely.
Yeah. But anytime you muck around with human physiology, whether in the body or in the mouth, you better know what you're doing. And I get what you're saying, and I don't think enough research has been done that's proven beyond a shadow of a doubt that that's safe to muck around with the physiology behind the development of the teeth. And so we if we went to the dentist and took Beckett to the dentist and he said, oh, he has a specific problem, he needs a fluoride application, we might consider that. But as far as drinking fluoridated water or just using fluoridated toothpaste and swallowing the spit, we're never going to do that. And I'm definitely not a fluoride conspiracy theorist. But I mean, like you said, there's no physiological need for fluoride in the human body. It's not an essential mineral. And so I think if you're eating the dental diet or the proper human diet, your teeth are going to be fine if you forget your fluoridated toothpaste. Wrapping up, Doctor, bring this home and give us your philosophy for healthy dental health and oral health and healthy teeth for human beings.
Yeah, so I mean, look, the one thing that I've found that's so kind of enriching about learning about health, meeting great doctors like yourself, Ken, is that the more we learn about the body, like the more fantastically resilient and diverse and just it's an amazing system we have. Your teeth are such a part of that, and I'm still learning every day about the amazing things that our teeth and our body can do. And, like healing cavities, I never, ever thought I'd be talking to, a medical professional about healing cavities. But these are the things that are in our reality now. And that one thing that, dental health and medical health has been disconnected, but I really hope that people can kind of bring that together in their own mind and understand that their teeth and their dental health is drastically connected to what's happening. And it's an earlier sign to what's potentially going into the doctor's office with a metabolic issue. You can stop it if you listen to your teeth. And so the foods that are written in your book, written in my book, that provide these nutrients, if you can get them 2 or 3 times a week. So say you cook. So one thing is I try and tell my people that are asking me try and get liver in a liver dish into your repertoire 1-2 times a week. Into hide it in your kids' meals if you can. Working these things slowly because we live in the modern world now. These things are difficult to get access to. Always understand that sourcing is important. So that where your animal foods come from, especially, is very important. How they were raised, because if they didn't get sunlight, they didn't eat grass. They don't convert these nutrients to the fat soluble vitamins that create strong bones and teeth. And every second, we are actually intervening and creating the environment for our jaws to grow. So that's breathing, through tongue posture, through chewing, all through just our shoulder and neck posture as well. So as a dentist, I get bad neck pain all the time, and it took me a long time to really kind of get a hold of that. But you have to correct your tongue posture, you have to correct your breathing, and it's related to how your jaw developed. And all of these things are interconnected, and it's an amazing system we have. And I'm just loving and speaking to people like yourself and getting the word out there that we have this innate ability inside all of us.
Yeah, I totally agree. We have the power to make ourselves sick, no doubt. and we have the power to cause ourselves to have cavities and dental abscesses, but we also have the power to change the course of our journey and to improve our health, both physical and mental and dental. All this stuff, what you eat is the foundation of your mental health, your physical health, and your dental health. It absolutely matters. And I can remember back when I was seeing 30, 40 patients a day, I would go into an exam room and have a little 2-year-old with an ear infection or something. And I always take a look in the mouth, and the poor little guy's dentition was just atrocious. I mean, just every tooth had a carie, the gums were inflamed. And it's like the poor young parents either didn't care, but I always give people the benefit of the doubt. I think they just didn't know that Coca-Cola that you're letting your baby drink, that is destroying their teeth. That candy. And, I can remember going to the dentist and they'd say, well, you don't need to eat sticky candy because if it sticks to your teeth, it'll cause a cavity. But no dentist ever told me, grains are just as bad for your teeth, right? And nobody, not a single dentist except you has ever badmouthed grains at all. And so I just think so many parents don't know. And that's why I encourage people watching this, share this video with your kids, with your grandkids, with your next door neighbor who has kids, because parents always want to do the best thing for their kids, always. And grandparents really want to do the best thing for their grandkids. But if they don't have the right information, and if they don't have the right step 1, step 2, step 3, then they don't know what to do. And so they wind up thinking, well, this is organic orange juice. I guess it's fine for my baby to sip on this in a sippy cup all day because it's organic and fresh squeezed. No, it ain't okay. That's going to lead to cavities. This is okay. It says this is organic stone ground wheat. That don't matter. That's not helping your child's teeth whatsoever. You got to feed your babies the dental diet or the proper human diet, however you want to call it. That's how you're going to help your babies not suffer from cavities and dental abscesses and having their wisdom teeth cut out and having braces. Because like you said earlier, I just saw a question go by. If you're developing your jawbones, you're going to have room for all your teeth and they're going to fit properly. Right? And so if you feed your child this diet from the ground up, the odds that they're going to not need braces, I would guesstimate 90-95% chance they're not going to need braces because their maxilla and their mandible are developed enough to hold all their teeth properly. What do you say?
Yeah, absolutely. This really needs to, what we're speaking about here, I think it needs to be heavily built into public policy because it's the most critical health information apparent that are shaping the health of the next generation. If they change these foods in the first formative years of a baby's life, they're going to stop any craniofacial deformities that lead to crooked teeth. So think about just the savings on wisdom teeth in surgery. So that goes straight back into the economy. If we save the money from braces, that's going straight back into the economy. We're stripping away all of this money people are spending on a health issue that is potentially debilitating. And just a perspective on that too is that when these jaw structures don't grow properly, we are now in the midst of a sleep apnea epidemic, and that's where people don't breathe right at night. They have this vibration in their airways, and their brain is panicking in the night, and they're put on machines. So doctors downstream are putting them on machines at younger and younger ages now. That's all a craniofacial growth issue because they don't have 3 molars at the back of their jaws supporting a huge airway that won't collapse because the bones hold them up and the muscles are designed around them. And so we're walking into an epidemic of this, and we are in the sleep epidemic now. If you look at the numbers, it's quite alarming. And the risk of heart attacks, the risk of obesity, the risk of Alzheimer's disease and dementia skyrockets when you don't sleep well. It all stems and begins in the jaw. And this is the human form. And your teeth tell you what to eat, and you can listen to them. You can shape how your kids' teeth develop. It's a message I think that we really need to disseminate into public policy because it's one of the most powerful and effective.
Yep, I totally agree, 100%. And not only can you change your child's physical life, but you can improve your own financial standing by implementing the strategies of the proper human diet or the dental diet. I think that, how much more empowering and powerful can you get from a very simple change in diet. Reclaiming the power over your own diet, I really feel like is step one in reclaiming the power over your entire life. And the more I go down this road with people like you, Dr. Lynn, and other experts, the more I see that when you take charge of your diet and all the power that gives you, that's step one in reclaiming power over your entire existence on this planet. So I want to just thank you from the bottom of my heart. This has been absolutely gold information. Everybody check out Dr. Steven Lin's book, The Dental Diet. I put a link to the book. I put a link to his website. And I really feel like we've got more to unpack, Doc. I'm going to have to ask you to come back in the next few weeks or months. We're going to have to go round two on this stuff because this is so important.
Oh, absolutely. I'd love to. I'd like to thank you too for the work you're doing. You're really diving in a scientific and applicable way for people. It's really important for patients out there, and it's so empowering to see docs all over the world kind of waking up to this. So thank you very much for this. And I'd love to come back and talk. You're completely where we need to be thinking about this stuff.
Yeah, thanks so much, Doc. Thank you guys for joining us. As always, you're welcome to share this video to help people, to help them improve their lives and take charge of their life again. I'll be back next week with another guest, and hopefully Dr. Lynn will not be afraid to rejoin me sometime in the near future, and we can go even deeper into this very, very important subject. Thank you, Dr. Lynn, and thanks everybody watching. This is Dr. Berry. I'll see you next time.